Hi, my name is Jessica, and I am going to present the intervention for the individual. So, for the assessment screening, we're going to complete an intake assessment, so biopsychosocial, to understand the client's background, history, and current situation. So, we're going to complete a full biopsychosocial, any medical problems, any mental health in the family, any substance use in the family, any issues they had growing up. We want to understand the full picture of Nico. We want to get a whole picture of what his life has been like, as well as his family history to understand. We're also going to use screening tools such as an adolescent drug involvement scale to screen for drug involvement, the problem-oriented screening instrument for teenagers, also known as the POSIT, and the Adolescent Problem Severity Index to measure other dimensions or psychosocial functioning. Those three scales are meant for adolescents. We're also going to speak to Nico's parents. Due to his age, we are able to speak to his parents. He does get a say because he is over the age of 14, but we are able to work with his parents as well, especially because his mom has some history of what has happened in the past with him. We're also, once releases are signed, we're also going to try and use school reports. If he's having trouble in school, if he did drop out, why did he drop out? What were his grades like? When did it happen? And any other relevant information to fully understand Nico's situation better. So it could be past substance use treatment, past mental health treatment, any current treatment that he's receiving, anything to understand a complete picture for Nico. The level of care recommendation based off of Nico's situation, he should complete cognitive behavioral therapy for both mental health and substance use. He needs dual diagnosis. He really needs an integrated co-occurring treatment. So he does need to complete detox first, and then go to an inpatient for co-occurring treatment for substance use and mental health using cognitive behavioral therapy. The treatment should be about 30 to 90 days, depending on insurance. Insurance doesn't always cover those 30 to 90 days. If he is only able to do 30 days, he should move to a step down to continue his treatment, which is intensive outpatient, also known as IOP, which is typically 3 days for a certain amount of time. Typically is when it starts. It can be more, but it's usually 3 days. And then after he successfully completes the IOP, he can move down to the outpatient treatment until he is successful with treatment. He also, if it's helpful for him, considering his situation, he can be in a recovery house while doing outpatient treatment. So I'm going to explain cognitive behavioral therapy treatment, also known as CBT. So CBT is an approach that uses cognitive or behavioral strategies to identify new behaviors. The client's way of thinking about self, environment, and future is negatively disordered, which creates behavioral problems. So CBT teaches the client new and more effective skills for improving self-care, self-regulation, stress reduction, and interactions in social situations. So this helps minimize negative thoughts and feelings. Converting negative thought process into positive thoughts and activities can enhance the capacity to resist temptation in high-risk situations. So CBT ultimately takes a negative thought, and kind of reverses it is the way, kind of flips it is the way I like to explain it, into something positive to help them understand where those behaviors and those thought processes are coming from. So some techniques and tools that are involved with CBT are problem solving, self-monitoring, goal setting, decision-making skills, communication, social skills, and relapse prevention. There are negative effects that are addressed through anger management, assertiveness, training, and relaxation techniques. So for example, biofeedback, meditation, exercise, body scans are good. So it's really addressing those negative emotions. Thought records are also helpful. There are apps now that it's kind of like a thought diary. It puts a thought in there and then it has you answer questions to kind of test the thought, if it's a true thought, or if it's factual or not factual. There is also a pleasant activity schedule that they can make. So these are activities that are positive for them, that do not involve using substances, and that kind of help with their schedule and give them things that they enjoy and they like. Some skills for triggers are recognize. So recognizing when that behavior is coming up or when that thought is coming up, avoiding that behavioral and that thought, and finding a way to ultimately cope. So coming up with those coping skills and strategies to avoid that behavior or that thought or that trigger. So some goals and objectives for Nico. So the ultimate goal for Nico is for him to stop using all substances. Nico will be provided with tools and coping strategies to help him in his recovery. He will participate in both substance use and mental health treatment. So the ultimate goal is for him to be successful in his treatment and to be abstinent from all substances and to continue in his integrated cognitive behavioral therapy and to be successful. Some times and sessions for Nico. So he should participate in detox first. And then he should participate in inpatient treatment for 30 to 90 days, depending on what insurance allows, which is for co-occurring disorders. So it should be an integrated for mental health as well as his substance use. He should participate in intensive outpatient IOP 3 days a week until they are able to step down to outpatient. So once he's done his inpatient treatment, he should participate in IOP. And then after while he's doing all this, he should be participating in weekly group therapy and individual therapy. Some strengths for CBT. CBT can be just as effective as medication without taking medication. It can be completed in a shorter time frame. It focuses on retraining your thoughts and changing your behaviors to make changes in how you're feeling. It also uses skills that are useful. It provides you skills that are useful for everyday life that help in the future. So it's something that you can use long term and not just right now. It can be useful for individual treatment as well as group treatment. Some weaknesses for CBT: the client must be willing to commit. If the client's not willing to work it, it's not going to work. If they're not present, if they're not willing to do the work, then it's just not going to be successful. And they have to be working on themselves in between sessions. So if you meet with them once a week, in between those sessions, they really have to be willing to put in the work. They must attend regular sessions. So that means no missed sessions, no saying, oh, I attended this one, but I'm not coming back for 2 weeks. And the client is only working on changing themselves. So they're only working on changing their thoughts, their feelings, their behaviors, and it's not addressing all of the systems around the client. So it's really sort of one-dimensional because it's only on the client, but we're not focusing on everything else that's surrounding them. Some methods of evaluation of cognitive behavioral therapy. Recovery. Nico is no longer using substances and he's on the road to recovery. His behavioral changes. There's an improvement. He's positive, he's happy, he's doing well. Difference in thoughts for Nico. How is he doing with his triggers? Is he having triggers? Is he having those behaviors that he was having when he was using substances? Is he still doing the same thoughts or the same things that he was doing before? There's also evidence that Nico is distancing himself from those who use substances. He's making better choices. He's making positive choices. He's just overall having a better positive thought process. And there are several evaluation measures. You can also redo the measures that we did in the intake to kind of see and gauge where Nico's thought process is. Ultimately, prognosis for Nico. If Nico can successfully engage in cognitive behavioral therapy, he will change his thoughts and his behaviors. Nico will then continue in recovery successful. the ultimate prognosis is for him to not use substances. He will be provided the tools and coping skills for his substance use recovery and mental health treatment. So ultimately, he will have better thoughts and more positive behaviors, and he won't be using substances any longer. My empirical-based practice, the first article that I used was On the Learning Curve, the emerging evidence supporting cognitive behavioral therapies for adolescent substance abuse. So this article essentially provided empirical evidence that group and individual cognitive behavioral therapy was associated with significant and clinically meaningful reductions in adolescent substance use. The research supported that there were significant developments in treatment and in outcome, and it basically laid the foundation for validating CBT for adolescent substance use treatment. It really focused on improving engagement techniques, especially for other co-occurring disorders such as conduct disorder and other individuals who will benefit from CBT. The second article that I had was linking session focus to treatment outcome in evidence-based treatments for adolescent substance use. So this article provided empirical evidence that is successful in treating adolescents' drug abuse and co-occurring symptoms, which was related to in-session focus on family-related treatment. So there were benefits focusing on family-based therapy, as there are with cognitive behavioral therapy. So it kind of showed that individual cognitive behavioral therapy was just as beneficial as family therapy when treating adolescents for substance use. While the techniques were different for both of them, they were both very equally successful. And these are my references. And thank you for listening to my presentation.